Question number 1. Describe the composition of cerebrospinal fluid. The normal composition of CSF is clear and colorless, and it should contain more sodium and chloride than is found in the blood, and less glucose, potassium, and calcium than is found in the blood. When a disease of the spinal or brain is suspected, during that time they will do the analysis of the cerebrospinal fluid to identify the disease. Composition and functions of cerebrospinal fluid. Cerebrospinal fluid is an ultrafiltrate of plasma contained within the ventricle of the brain and subarachnoid space of the cranium and spine. Number 1. It performs the vital functions including providing nourishment, waste removal, and protection of the brain. Second one, adult CSF volume is estimated to be 150 ml. The purpose of CSF is to provide nutrients, remove waste, and cushion the brain and spine. The normal composition of CSF is, already I have told, this is colorless and it should contain more sodium and chloride than found in the blood. Less glucose, potassium, and calcium than is found in the blood. CSF contain more sodium, means Na plus, and chloride, Cl, than blood, but less sodium means K plus, calcium means Ca plus plus. Protein and glucose. Normal CSF glucose is usually 2/3 of blood glucose. Normal CSF protein is 15 to 60 mg per 100 ml and contain no red blood cells, means RBC, or clotting factors, and only 0.0 to 3. White blood cells means WBC. Cerebrospinal fluid is clear, colorless, watery fluid that flow in and around our brain and spinal cord. Our brain and spinal cord make up our central nervous system. It controls and coordinates everything you do it, including our ability to move, to breathe, to sing, to see, to think, and etc. Question number 2. Describe the different stages of erythropoiesis. Stages of erythropoiesis: pro-erythroblast, erythroblast, normoblast, reticulocyte, and erythrocyte, means fully mature red blood cells. Erythropoiesis is from Greek word, meaning is erythro, meaning is red, and poiesis, to make it, is the process which produce the red blood cells, means erythrocytes, which is the development from erythropoietic stem cells to mature red blood cells. Hematopoiesis. Now, stages of erythropoiesis. First stage, pro-erythroblast. Earliest identifiable erythroid cell in the bone marrow, 15 to 20 nucleus with fine chromin and one or more nucleic dark blue cytoplasma. This is the first stage. Second stage, basophilic erythroblast, means which each stage from basophilic erythroblast to orthochromatic erythroblast cell size and nuclear size becomes smaller. Chromatin clubbing increasing and hemoglobin synthesis increases and cytoplasmic basophilic reduce. The nucleus is eventually extruded to produce a reticulocyte. This is the second site. Third one, then orthochromatic early blast. Already orthochromatic early blast is finished. Okay, next one, reticulocyte. This is the one of the stage of erythropoiesis, also called as polychromatic red blood cells. Nucleates contains remains of ribosomal, means RNA, and endoplasmic reticulum becomes mature red blood cells after 1 to 2 days in peripheral blood. This is fourth stage. Next one, mature red cells, means biclonium sixth stage, mature red cells, means biconcave nucleated disc with no organelles. Question number 3. Hypoxia. What is hypoxia? Hypoxemia is when oxygen level in the blood are lower than normal. If blood oxygen level are too low, your body may not work properly. Someone with low blood oxygen is considered, that is called as hypoxemia. Oxygen gets to your blood through your lungs. There are stages of hypoxia. In different stages occurs up to 1500 meter altitude, that is complete compensatory stage. The complete compensatory stage occurs between 5000 to 11,500 altitude. Then partial compensatory stage. Again, there are 4 stages of hypoxia, or each caused by lack of oxygen in any one of the areas. Those areas are hypoxia. Low amount of oxygen in the blood can leads to hypoxemic hypoxia. The most common cause of hypoxia, circulatory hypoxia, anemic hypoxia, and hysterotoxic hypoxia. There are 5 causes of hypoxia. Causes of hypoxia includes hypoventilation. Ventilation perfuse in mismatch the low oxygen contents in the air. Right to left, impaired of diffusion into the oxygen enter into the lungs. Causes in sickness leads to some of the disease condition. That is the some of the complications is also there. That is a pulmonary edema. High altitude, sometimes cerebral edema is also one of the cause for hypoxemia. If hypoxemia is there, means what type of care you supposed to take? That is a supplementary oxygen to treat hypoxia. An oxygen delivery device is attached to your nose with mask or tube to increase the amount of oxygen getting into our lungs and down to our alveoli, and mechanical ventilation in a hospital in circumstances of severe acute hypoxemia. This is a detail about hypoxemia. Question number 4. Contraceptive methods in female. These are the methods are caps, diaphragm, combination pills, condoms, contraceptive implants, contraceptive injection, contraceptive patch, and female condoms. Means again one more, that is IUD, intrauterine device or coil. Okay, now what is the meaning of contraceptive methods? It means birth control and also known as a contraception is the use of medicines, devices or surgery to prevent pregnancy. There are many different types. Some are reversible while others are permanent. Contraception can be used to prevent pregnancy, and some types of also protect against sexual transmitted diseases. Contraceptives that are more than 99% effective contraceptives implant. Intrauterine systems means IUS. IUD, intrauterine device, also called as coil. Some of the permanent methods is also there. For male, tubectomy and laparoscopy. For males, vasectomy. These are the methods are there. Other than that, natural family planning methods is also there. That is called as safe method. Means our menstrual cycle, you can have a sex without contraception with a reduced risk of pregnancy. Question number 5. Refractive errors of eyes and their co-reaction. Your doctor can correct refractive errors with glasses or contact lens or fix the refractive error with surgery. Glasses and eyeglasses are the simplest and safest way to correct the refractive error. Your eye doctor will prescribe the right eyeglasses lens to give you the clearest possible vision. Those are myopia and hyperopia are corrected with lenses. Andra means concave lenses are used to treat myopia. They are divergent. Convex lenses are used to treat the hyperopia. They are plus or convergent. It will treat with cylindrical lens also. 4 common refractive errors. Myopia. Make faraway objects look blur. Hyperopia. Make nearby the object look blur. Okay, then can make far away and nearby objects look blurry or destroyed the pre-myopia, makes it hard for middle age and old adult to see the things up. Okay, these are the 4 common refractive errors, means myopia, hypermyopia and hyperbopia, means which will be come in the middle age or in the older adult. Types of refractive errors, means again that is the myopia, hyperopia. Okay, these are the different types of refractive. Question number 6. Define GFR and give its normal value. GFR means glomerular filtration rate. Is a test used to check how well the kidneys are working. Specially, it estimates how much blood passes through the glomeruli each minute and renal functions, including maintaining an acid-base balance, regulating fluid balance, regulating sodium and potassium, other electrolytes also, and as well as clearing toxins, absorption of the glucose and amino acids and others. Okay, now what GFR and its value. Glomerular filtration rate is the amount of glomerular filtrate formed in all the nephrons of both the kidneys per minute. In a healthy individual, it is about 125 ml per minute. The glomerular filtration rate contains glucose, amino acids, sodium, potassium, urea, uric acid and ketone bodies, and also large amount of water. Question number 7. Give any 3 functions of growth hormone. The role of growth hormone include influencing our height and helping build our bones and muscles. A natural level of growth hormone fluctuates during the day, seemingly influenced by physical activities. For example, levels rise when we exercise. Growth hormone levels increase during the childhood and peak during puberty. There are 4 functions of growth hormone. The growth hormone enhances growth in adolescents and children. It also contributes to the regulation of body fluids, fat metabolism, sugar, and also the functions of the heart. The growth hormone reduces the body fat by increasing bone density and muscles mass. Question number 8. Name the different types of muscles. In our body, there are 3 types of muscles. Skeletal muscles means that is stratified, smooth muscles and cardiac muscles. Different types of muscles. Skeletal muscles, the specialized tissue that is attached to bones and allows movement. Smooth muscles located in the various internal structures including the digestive tract, uterus, and blood vessels such as arteries. Cardiac muscle. The cardiac muscles specific to the heart. Different types of muscles are different functions. Each type of muscles tissue in the human body has a unique structure and specific role. Skeletal muscles moves bone and other structure. Cardiac muscles contract the heart to pump blood. The smooth muscles tissue that forms the organ like the stomach and bladder changes shape to facilitate bodily function. Question number 9. Active transport across the cell membrane. Active transport is a kind of cellular transport in which substances like amino acids, glucose, and ions are transported across the cell membrane to a region that already has a high concentration of such substances. There are three main active transport methods: ion pump, exocytosis, and endocytosis. Membrane transport introduction. Life depends on the membranous ability to precisely control the level of solutes in the aqueous compartment, inside and outside. Breathing the membrane. Simple passive diffusion. Facilitate diffusion. Active transport or lenophorus. Question number 10. Draw a neat label diagram of a normal ECG. ECG means electrocardiogram. An ECG is a simple test that can be used to check our heart rhythms and electrical activities. Sensors attached to the skin are used to detect the electrical signals produced by our heart each time it beats. ECG test for simple non-invasive test that records the electrical activities of the heart. An ECG can be help to diagnose certain heart disease, heart conditions including abnormal heart rhythms and coronary artery diseases, heart attack, and as well as angina. What are the signs and symptoms before you supposed to take the ECG? If patient complains chest pain, rapid and irregular heartbeat, shortness of the breathing, dizziness, and fatigue. In this condition, you have to check the ECG. Which are the most common ECG abnormalities means ECG changes are non-specific ST segment and T wave abnormalities which may occur because of myocardial injuries or ischemia caused by the tumor. Then normal ECG diagram is also there. You have to draw the diagram. First one is there are three depolarization is there. First one atrial depolarization, second one ventricular depolarization, third one ventricular repolarization. These are the three types. You have to draw the diagram and you have to make it PR interval. Question number 11. Functions of skin. The human skin is the outer covering of the body and is the largest organ of the integumentary system. The skin has up to 7 layers of ectodermal tissue, girding muscles, bones, ligaments, and internal organs. There are 6 functions of skin. The skin performs 6 primary functions, which include the protection, absorption, excretion, secretion, and regulation, also sensation. These are the primary functions of the skin. The skin functions as our first line of defense against toxins, radiation, and harmful pollutants. The primary functions of the skin is protection is protect us from harmful UV rays, means dehydration and entry of pathogens. It prevents us from mechanical shocks. It is a sense organ that feels the sensation like pain, touch, heat, etc. Question number 12. Test of pregnancy. How does a pregnancy test work? All pregnancy tests detect the hormone human chorionic gonadotropin, means HCG, which starts to produce around the 6 days after fertilization. Must pregnancy test come in a box that contains 1 or 2 long sticks. You pee on the stick and the result appears on the stick after a few minutes. Common test during pregnancy: genetic screening, first trimester, second trimester, ultrasound, amniocentesis, chorionic villi sampling, and fetal monitoring, glucose level. These are the tests are important during pregnancy. Question number 13. Define receptors. Name any 2 sensory receptors and receptor. Sensory receptor in physiologically any structure which on receiving environmental stimuli produce an informative nerve impulses. Receptors in biochemistry, a protein molecule that receives and responds to a neurotransmitters or other substances. Types of receptors: nuclear receptors, enzyme linked receptors, G protein coupler receptors, linked gated ion channels. Receptors come in many types, but they can be divided into 2 categories: intracellular receptors, which are found inside the cell, and cell surface receptors, which are found in the plasma. Question number 14. Name any 3 gastrointestinal hormones. GI hormones are chemical messengers that are implicated in many aspects of our physiological functions of the gastrointestinal tract, including the regulation of secretion, absorption, and digestion, and gout mortality. Gastrointestinal hormones that regulate gout, mucosal growth positively or negatively include gastrin, secretin, somatostatin, and ghrelin and bomacin and gastrin releasing peptide. Major gastrointestinal hormone. Gastrin helps in the secretion of hydrochloric acid into the stomach. Secretin stimulate the secretion of water and bicarbonate ions from the pancreas. Cholecytokinin synthesis and secretion of bile juice and pancreatic enzymes. Question number 15. Give the normal value of platelets, WBC, PCV, and normal WBC and platelets. White blood cells count is 3,300 to 8,700 cells per cubic millimeter in thousands bar mm cube. Platelets count 150,000 to 450,000 per cubic millimeter. Normal platelets. A normal platelets count in adult range from 150,000 to 450,000 platelets per microliter of blood. A platelets count of less than 150,000 platelets per microliter is lower than normal. When you have a low platelet count, you may have trouble stopping bleeding. PCV is the measurement of the proportion of the blood that is made up of cells. The value is expressed as a percentage or fraction of cells in blood. For example, a PCV of 40% means that are a 40 milliliter of cells in 100 milliliter of blood.